Hi, my name is Sam. I'm a PA student. Can we start off by you just confirming your name and date of birth, please?
Katie Ansell, 7/19/99.
Great. And before this, I wash and sanitize my hands. We're going to start off with vital signs. So the first thing I'm going to do is palpate the brachial artery by having go like this and then coming medially to the left. Now that I found it, put the cup on and line up this with the brachial artery. Making sure it's not too tight or loose. The patient's arm is at heart level. I'm going to lean on here. And I'm going to estimate her systolic blood pressure by palpating her radial pulse until it diminishes. That was 130, so I'm going to add 30 millimeters of mercury to that, and that's what I'm going to pump up the cuff to. So now I'm going to take her blood pressure by putting the diaphragm of my stethoscope on the brachial artery and pumping it up to my estimated systolic plus 30. Patient's blood pressure was 112/70. Now we're going to do the skin. For demonstration purposes, I'm going to be focusing on her arm, her scalp, and her nails, but normally we would do the whole body. To assess her arm for the skin, she has no pigmentation changes, redness, pallor, cyanosis, or jaundice, and no macules, papules, abrasions, ecchymosis, or any rashes. The skin is warm to touch by using the back of my hand. It's not dry or sweaty, and it's smooth. She has good motility and turgor by doing this. And her hair is evenly distributed with smooth texture, no lesions, dryness, or signs of hair loss. And now looking at her scalp, I also see that the hair is all evenly distributed with smooth texture. There's no lesions, dryness, or signs of hair loss on her scalp. And moving to her nails, I see that the nails have uniform color. They're even shaped without lesions, pitting, clubbing, or cyanosis. Now we're going to move on to the peripheral vascular system. So I'm going to start by inspecting her upper and lower extremities for lesions, ulcers, skin and hair changes, temperature, and color. Doing that temperature with the back of my hand. And there are no lesions, ulcers, changes in hair texture, or distribution, and the skin is warm and pink. Now for her legs, for her distal extremities, feeling for temperature, and again, there are no lesions, ulcers, changes in hair texture, or distribution. The skin is warm and pink. Now I'm going to check her capillary refills for her fingers and toes. So for her nails, I'm pressing down on the nail bed, and the capillary refill is less than 3 seconds. And now for the toes, she does have nail polish on, but the capillary refill is less than 3 seconds. Now I'm going to palpate her radial and brachial pulse for the upper extremities. For the radial, it's this. And then for her brachial, flex this way. And now I'm going to compare them bilaterally. So I'm going to come over on this side, feel here, and then I found that it is a brisk upstroke 2+ bilaterally. And now I'm going to move on to her distal extremities and palpate her dorsalis, pedis, posterior tibialis, and compare them bilaterally as well. Where dorsalis pedis is here, and her post-tibial tibialis back here. And now comparing them to the other foot. And those are a brisk upstroke, 2+ bilaterally as well. I'm now going to check for edema in my patient's lower extremities by pressing my thumb. And there seems to be no edema present. And now I'm going to palpate her axillary nodes, the anterior, posterior, central, and lateral ones. They're up here. Her anterior nodes is up here, palpating. Her posterior node is over here. Her central node is in her armpit area here. And then her lateral node up here. And after palpating her anterior, posterior, central, and lateral nodes, I found that there is no lymphadenopathy. Moving on to the head, I am going to inspect contour, scalp, hair, and hair distribution. She seems to have good symmetrical head contour. There's normal hair distribution, no signs of hair loss, no lesions, redness, or dryness. Now we're going to move on to the eyes. The first thing I'm going to do is inspect and palpate the nasolacrimal ducts with my thumbs. And there is no swelling, inflammation of the nasolacrimal ducts. Now moving on to the eyelids, eyebrows, and eyelashes. Her eyebrows are symmetrical with no flaking or redness, and they also don't have any trichotilliosis. Her eyelashes are symmetrical with no trichotilliosis. And to inspect her sclera and conjunctiva, I'm going to lift up her upper lid and her lower lid on both sides. The sclera is white with no jaundice, the cornea is clear with no abrasions, and the conjunctiva is clear bilaterally. There's no inflammation or injection of conjunctiva or evidence of corneal abrasions, and there's no swelling. Next, I am going to assess visual acuity in my patient using this Snellen chart. So I have her standing here, and I'm going to walk 6 feet away. I'm going to hold the chart in good light, and I'm going to check both of her eyes and then them separately. I am going to ask my patient to read the lowest line that she can see on the chart. First, cover your left eye, and which line?
I can see the bottom one.
Okay.
So L, T, F, P, H.
Okay. Can you cover your right eye? And can you read it from right to left?
H, P, F, T, L.
Okay. And can you uncover your eyes and read the lowest line?
L, T, F, P, H.
My patient appears to have 20/20 vision in her right eye, 20/20 vision in her left eye, and 20/20 vision for both. Now we're going to assess color blindness. Can you cover your left eye, and what color do you see?
Red.
What about this one?
Green.
Okay, now can you cover your your right eye, and what color is this?
Green.
What color is this?
Red.
Now can you uncover? What color is this?
Red.
What color is this?
Green.
My patient shows no signs of color blindness. Now I'm going to assess my patient's visual field by confrontation, and I'm going to use the wiggle test. So I'm going to have you shut your right eye. I'm going to shut my left, and I'm just going to tell me when you see my fingers wiggle.
I see it. I see it. I see it. I see it.
Okay, now other side. Tell me when you see my fingers.
I see it. I see it. I see it. I see it.
Her peripheral vision seems to be intact. Next, I'm going to assess my patient's EOM by moving my finger in an H shape. Follow my finger with just your eyes. Don't move your head, please. extraocular movement seems to be intact, and there is no nystagmus and no lid lag. Now I'm going to assess my patient's pupil equality and to see if her pupils reflect to the light bilaterally. I'm going to start with her left eye with my pen light. Bring the light in, and her pupil should constrict. And the other eye. Okay, that was direct, and now I'm going to do consensual. I'm going to start with her left eye, and her right pupil should constrict. And I'm going to put my hand here just to block. Both pupils constricted. Now I'm going to assess my patient's pupil accommodation by having her focus on this wall in the middle, and I'm going to bring my finger in to about 6 inches to her face, and her pupil should constrict to that. So if you could look at that wall, focus on it, and then when you see my finger come in, focus on my finger. And both of her pupils constricted. My patient's pupils are equal, round, and reactive to light and accommodation. Now I'm going to do the fundoscopic exam on my patient's eyes, starting with her right eye. I'm going to have her look into the middle of that wall, focus on that. Ideally, we would be in the darkened room, but we can't turn these lights off, so I'm going to use my fundoscope to examine her right eye as she's looking in the distance. I am looking to find a red circle. I'm going to move in slowly and use my right eye for her right eye. I visualized a red reflux. There was no AV nicking and sharp distinct margins of the optic disc. Now I'm gonna do this bilaterally on her left eye. She's still focused on something in the distance, and I'm gonna use my left eye to visualize her left eye, looking for the red disc again. So to conclude, she bilaterally has a red reflex. There's no AV nicking and distinct margins of the optic disc in both eyes. I'm going to assess my patient's auditory acuity by performing the whisper test. So I'm standing behind my patient. I'm going to test her right ear first by covering her left and whispering 3 random words, and then she's going to repeat them to me.
Oh, come on.
Dog, cat, ball.
Dog, cat, ball.
Okay, those are right. House, cat, rabbit.
House, cat, rabbit.
So my patient appears to have no bilateral hearing loss. I'm going to test my patient's auricle, tragus, and mastoid process. I'm looking for tenderness. Auricle, tragus, and the mastoid process. And there's no tenderness present, and there's also no leaking of the ear. And I would have done this to the other ear, so it would have been bilaterally, and I would have compared. I'm going to be performing my otoscopic exam bilaterally on her ears. I'm going to turn my otoscope on, hold my instrument like this, and I'm going to pull my patient's ear up and back to visualize the ear. I found that there is no ear canal erythema, there is no discharge and no cerumen. I also found that the tympanic membrane appears pearly gray, and I visualized the handle of the malleus and the cone of light. There are no bulging, redness, or lesions, and I completed this test bilaterally and compared. Next, I'm going to perform the Weber test. Let me know if you can hear the sound in both of your ears.
Yes.
The sound is heard equally in both ears. There's no lateralization. Now I'm going to perform the Renee test. If you could just tell me when you stop hearing the sound.
Well, you can shot. This is a shot. I don't care.
Okay, stop. Do you hear this?
Yes.
This tells me that my patient's air conduction is greater than her bone conduction. And I would complete the Renee test bilaterally to compare both ears. Moving on to the nose, I'm going to inspect my patient's nose and test for her patency bilaterally. Can you breathe in now? Good. How about now? Okay. I found that she has good patency bilaterally. Now I'm going to assess her olfactory acuity by placing this almond under one of her nostrils, and she's going to close to see if it's bilaterally. She wouldn't know this is an almond in a real setting, but can you shut your eyes? Can you smell that? Can you smell that? Okay. Conclude that her olfactory is intact bilaterally. Now I'm going to examine her nose with my sputum bilaterally. Turn it on. I found that there are no polyps, the septum is midline, the nares are symmetrical, there is no discharge, and the nasal mucosa is pink. Now I'm going to palpate her frontal and maxillary sinuses. I found that there is no edema, no tenderness, and no ecchymosis. Now moving on to the mouth and throat, I'm gonna inspect my patient's lips, oropharynx, hard and soft palate, and her buccal mucosa. I'm gonna use my tongue blade and my pen light. I'm gonna have you go, ah. I found that her lips are pink and moist and there's no dryness. Her oropharynx, hard soft palate, and buccal mucosa are pink with no pallor and no petechiae. I also found that there is no redness, no exudates, and no discharge. If you're inspecting her posterior pharynx and tonsils, I found that they were pink with no lesions, erythema, edema. There was no postnasal drip or exudates. Now I'm going to inspect my patient's teeth, gums, and tongue, lateral and underside. I'm going to have her open her mouth but not stick out her tongue. And she has good dental repair, no cavities, no swelling, redness of the gums, and looking at the tongue, I found that it was symmetrical. I'm gonna assess my patient's tongue protrusion for symmetry. Can you stick out your tongue? And I found that her tongue is symmetrical. I would also perform a gag reflex with my tongue blade and my light. I'm looking for the symmetrical rise of the soft palate and the uvula. Start with the neck. I'm gonna palpate my patient's lymph nodes, starting with the preauricular, the postauricular, the occipital, tonsillar, submandibular, and submental. Her superficial cervical, her deep cervical, which is under her sternocleidomastoid, her posterior cervical, and her supraclavicular cervical. After palpating her lymph nodes, I found that there is no lymphadenopathy. Next, I'm going to inspect my patient's thyroid by having her swallow, and I'm going to palpate it, and the thyroid should go up and then down. Can you swallow for me? Yep. I also found that there are no nodules, tenderness, or enlargement of the thyroid. Now I'm going to assess her trachea for deviation. And there appears to be no tracheal deviation.